I'm Christian Espinosa, founder of Blue Goat Cyber. We've worked with more than 250 submissions with the FDA and globally, and we haven't had any rejections. So we know what the FDA is looking for. So the next 10 minutes, I'm going to walk through exactly what 524B says and what exactly is a cyber device. So there's a lot of confusion about a cyber device, so I'm going to provide some clarity on what a cyber device is and if your product meets the definition of a cyber device according to 524B. So let's dive right into it. Section 524B is the law that made medical device cybersecurity mandatory. We went from optional to now mandatory, and this has really shaken up the industry quite a bit. So in this masterclass, we're going to talk about what some of the components are of 524B and why it's important and how it's evolved and how it's enforced as well. March 29th, 2023 is the effective date that 524B took effect, and the FDA started having the initiative to issue refuse to accept if your submission didn't include the right cybersecurity controls. They didn't really enforce this till later on. They started enforcing it around October 1st, 2023, and then they slowly started gradually enforcing it more and more and more, but they gave you a little bit of buffer time. So March 29th was the effective date, and then October 1st is when they started enforcing this date. And this applies to every 510K, de novo, PMA, PDP, or HDE filing with the FDA for anything that is considered a cyber device, and we will get into what is considered a cyber device in a minute. As we mentioned, cybersecurity is no longer optional, it is now mandatory. And this is a big shift with medical devices. I'm glad we're shifting this direction because with medical devices, patient safety is at stake. So it's important we consider cybersecurity from the design all the way to disposal, or from cradle to grave, which is what the FDA is pushing us towards today. 524B is the law. It's one definition, one trigger, and 4 requirements. And the timeline you can see here on the slide, it was actually signed into law December 29th, 2022. It became enforceable March 29th, 2023. And then we had some guidance about it that came out. And I'm going to explain here later how the guidance ties into the law. The September 27th, 2023 FDA guidance was one of the first guidances that operationalized the law. And now we have the February 3rd, 2026 guidance, which further operationalizes how the law is going to be enforced. This is a good analogy here that shows how the two tie together. So the statute or the law is section 524B. It is broken down into various components. Section C defines a cyber device, which is anything with software and a way to connect to it. And we'll go into a little more detail of that in a second. 524B Section A defines the pathways, the 510K, de novo, PMA, PDP, HDE. These are the applicable pathways that 524B applies to. And then 524B Section B defines the 4 cybersecurity requirements. And we'll go into those in a second as well. And then the RTA, or the refuse to accept, means if you don't meet the requirements, the FDA feels like you haven't done your cybersecurity diligence, they'll just refuse to accept your submission, and you have to do everything correctly, then resubmit. So 524B is a statute. The guidance is how it is operationalized. The latest FDA guidance is February 3rd, 2026. It says it's non-binding, is what the FDA says, but it really operationalized the the law or the statute of 524, which is binding. So what the FDA guidance does, it operationalizes those 4 requirements. It interprets the statutes into practice, so you know what to follow, you know what to do. It's more specific, more prescriptive, and it aligns to QMSR, the Quality Management System regulation as well. So now, cybersecurity equals quality, and it's part of a quality management system. So the statute is the obligation that doesn't change. The guidance is the operational rule book, and that can be revised later on. So how we operationalize the law or the statute can change as the FDA sees fit. The definition of a cyber device is broader than most people think. Most people think a cyber device means it has to be directly connected to the internet in some capacity. That is not true at all. A cyber device, according to 524B and the FDA guidance, simply means it has software, it has any way or any means to connect to the internet. This is where it gets fuzzy for people. Any means to connect to the internet means it could have a USB port. I could plug a Ethernet adapter into the USB port or a Wi-Fi adapter. It could have Bluetooth, RFID, magnetic coils such as NFC. Any way basically to connect to that software means it is a cyber device. And we see this quite often where a lot of our clients or prospects will kind of argue with us that they think their device is not a cyber device, but they have a USB port and they'll say it's only used for maintenance. It doesn't matter if that USB port is exposed or it's easily accessible, then that device is still a cyber device. The third test here, it has the potential to have a vulnerability. I don't really think that's too relevant because technically if you have software and a way to connect to it, at some point you are going to have a vulnerability. So those are really the two driving factors: software and any way to connect to that software. Even the NFC, like the tap on your credit card, that is a way to connect to software, and that is a way that an attacker can get into the device. So that means your device is a cyber device, which means 524B applies to your device. The four statutory requirements, and the fourth one is pretty vague, but the four are: you have to have a cybersecurity plan. This is a post-market management plan. So once your device gets cleared by the FDA or approved by the FDA, that's like step one. But now it's out there deployed in a healthcare delivery organization or a hospital or a clinic, you have to have a plan to monitor that device for new vulnerabilities. So you have to monitor your software bill of materials. You have to have a way to look for new exploits that may affect a component in your software bill of materials. And you have to have enough infrastructure behind the scenes to support that whole monitoring and triage for your deployed devices. Because cybersecurity, as I mentioned earlier, is from cradle to grave. It's not just to get your device cleared through a pre-market submission. It has to be monitored later on. And that's requirement number one, that plan to do it. And then the FDA has the right to come back and audit you and make sure you're executing your plan properly. We've had a couple clients go through audits recently where they submitted a plan and the FDA has come to them and said, I want to see the artifacts, the evidence that you're actually executing the plan you submitted as part of your pre-market submission. So they wanted to see the evidence of the post-market management plan or the cybersecurity plan being implemented properly. The second requirement is secure design and maintenance processes. The main component of this is the updatability and patchability and a way to make sure that that process is secure. So you can have the plan to monitor, which is requirement one, for a new vulnerability, but once you discover a new vulnerability, requirement number two is, how do I deploy a patch and how do I develop that patch securely in a way that it doesn't get malicious code injected into it? That is requirement number two. So I may be doing the patch over the air. I may have to still send a field technician to the device and physically plug into it to update the patch. I may have to give instructions to my client on how they update the device, but that is requirement number two, and that has to be a secure process because we've seen in the news with like SolarWinds and all kinds of attacks, they're often an attack through the supply chain, and it's often attacked through the update process. So we need to make sure we have a secure update and patching process. The third requirement is the software bill of materials. The software bill of materials is just the ingredients that make up that software or that device. The ingredients are the third-party components that have been borrowed by the developers to put into that code. Developers don't write everything. If there is a authentication function that somebody else has already written, they often borrow that function and put it into their code. That would be one of the ingredients that make up the code. The software bill of materials is not enough. The ingredient list is not enough. We have to know what the vulnerabilities are associated with we have to know what the vulnerabilities are associated with each ingredient, and we have to know the level of support that the provider of that ingredient maintains, as well as the end of support. So when is that component no longer going to be supported? And this is important because this gives us a risk profile of all the ingredients that make up our product. And then requirement number 4 is just an open-ended requirement that says if the FDA decides to add something else, then it still falls under 524B, and you're required to do that from a cybersecurity perspective. And at Blue Goat Cyber, we have 18 deliverables that align with a pre-market submission. Some people have less than 18, but we do the 18 to make sure we hit every requirement for the pre-market submission that aligns with the February 3rd, 2026 guidance. Why did 524B come about? Well, as we've heard in the news, and we still see in the news on a routine basis with various medical device manufacturers being attacked. I think in the past month, we've had 5 strategics attacked. The challenge is today that cyber attacks are no longer just something that is conceptualized. I'll repeat that here. Today, cyber attacks on hospitals are actually tangible because we have evidence that they have resulted in people dying. As an example, 80%, there's an 80% rise in cardiac arrest around hospitals that have had a ransomware attack. So the scenario is if I am arriving in an ambulance because of a heart attack in the hospital I arrived to can't intake me because all their systems are down by ransomware, that greatly increases my likelihood of the heart attack being fatal. So these are real risk and real consequences, and people have started to die because of it. So I'm glad to see the FDA and Congress is starting to take this seriously. This is no longer about just stolen data, it's about patient safety. And it's slowly been a pivot from you could get by with a submission that had a little bit of cybersecurity stuff into it. Now it's a massive lift. Cybersecurity is becoming one of the main reasons that pre-market submissions are being rejected or pre-market submissions have deficiencies, because this is becoming a major challenge. And as I mentioned earlier, it's not just the pre-market, it's also the post-market. So the FDA wants to see your plan for post-market, and they may audit that plan as well. And a lot of people still think medtech cybersecurity is about the data, and I have a lot of discussions with people about this. It is about the data, but the data is really secondary. There's a quote from me on the bottom here, and this just puts things in perspective. If you have an implantable like a defibrillator, and there's been compromised defibrillators, Dick Cheney had his wireless capability of his defibrillator removed. But if you have an implantable, such as a defibrillator, and somebody has compromised it wirelessly, and they're able to shock you at their will, while at the same time they're still in your protected health information, which one is a priority? You can recover from your protected health information or your sensitive data being stolen, but you can't recover from being shocked to death. And this is the world we're starting to live in. So this is why the FDA has made these cybersecurity requirements mandatory. Unfortunately, this is still catching a lot of manufacturers off guard. As I mentioned, cybersecurity needs to be from design to disposal or cradle to grave. A lot of manufacturers still wait too long. They think cybersecurity is a point-in-time study, or it just needs to be done one time, like a one and done. That is not true. Unfortunately, a lot of people don't consider cybersecurity, and we see this all the time at Blue Goat Cyber, until roughly 60 days before their submission timeline. Then they come to us, they haven't done hardly anything about cybersecurity. We do penetration testing. We do this, run the software bill of materials through our analysis tool. We look at the vulnerabilities. We look at the static application security test, and we find often thousands of things wrong. They cannot fix typically those thousands of things we identify within that 60-day time frame, which therefore delays their submission. So it's important to consider this early on, as early as possible, like we said, from design all the way to disposal. And you should really be looking at cybersecurity as part of your requirements, actually, not just the design, because the requirements influence the design. And unfortunately, if you wait too late, it'll result in a deficiency or even a refusal to accept. The refusal to accept is what 524B allows the FDA to do, which means they simply don't accept your submission and you have to start over. If you get a deficiency, it starts a 180-day clock for you to resolve those deficiencies. Unfortunately, today we have a lot of prospects come to Blue Goat Cyber that have a massive list of deficiencies from cybersecurity because they didn't really do anything with cybersecurity, and it is a massive challenge to fix those deficiencies within 180 days because it often requires design changes, rework, because if you didn't design your device properly to begin with cybersecurity and you then try to submit it, you may have to rework and redesign your device, which is a massive lift for most organizations. We often hear the argument that, well, my device is a low-risk device. It's not a class 3, it's a class 2, and it only does X, Y, and Z. So do the cybersecurity requirements still apply? The answer is yes. It doesn't matter if it's a low-risk device, a high-risk device, a medium-risk device, a very low-risk device. None of that matters. What matters is, does it meet the definition of a cyber device? That's all that matters. Does it have software and a way to connect to it? If it does, then you need to do all the cybersecurity requirements, all the documentation, all the testing. The only thing that changes is the level of depth may be different for a low-risk device versus a very complex implantable, as an example. But we still have to do all the exact same 18 deliverables, just different levels of depth. Like a class 2 510K oxygen pump, we've worked on quite a few of these. Can be very relatively simple and require maybe a few hundred pages of documentation from a cybersecurity perspective to submit to the FDA. Whereas a surgical robot on the tier 3 side, class 3 PMA submission, that may require 1,000 pages of documentation from a cybersecurity perspective. But it's still the same process, just a level of detail driven by the complexity and the risk profile of the device is what changes. And from what we've seen, most deficiencies really have nothing to do with a bad device. It's really about what you put in the submission. It's not what the device does or how secure it is. You have to be able to prove it with the artifacts that are part of those 18 deliverables. And you have to have the traceability as well that says that this test resulted in this result or this output. If the risk was high from the output, then we changed it. We may change the software, and now it's lower, and now I have that whole traceability as well. So we have to be able to prove our device is secure. It doesn't matter if it already is a great device. We still have to have that body of evidence that the FDA is looking for in that pre-market submission. So quickly, 5 habits to drop and 5 to adopt. The fastest path to a refuse to accept or deficiency is to assume that no internet means not a cyber device. I've been talking about a cyber device quite a bit. Simple software, any way to connect to it. That could include a USB port, NFC, RFID, it doesn't matter. Any way to connect to it makes it a cyber device. So on the right side there, run the cyber device test. Is there software and any way to connect to it? If the answer is yes, it doesn't matter if it's a low-risk device, you still have to do all the cybersecurity requirements for your submission. Don't wait 60 days before don't wait 60 days before filing to start your cybersecurity work. As I mentioned, it needs to be from design until disposal. It's not a final sprint or a point-in-time study. It's an iterative process, a continuous iterative process. Something else we see quite a bit, we see clients that got a submission through before March 2023, before the cybersecurity requirements were that big of a deal. They try the same approach, it doesn't work. So you have to alter your approach because the guidance has changed. 524B came about. So just because you got something through in 2023 doesn't mean it's going to, that same package, the same documents are going to work today. You need to update that and consider the new guidance. The fourth habit to drop is to hand wave the post-market management plan and just say, we'll do patches. That's not sufficient. The FDA wants to specifically see what your plan is, and that was one of the requirements from 524B, what the plan is. So when there's a new vulnerability, how is it discovered? What do you do about it? Who's contacted? Do you have a coordinated vulnerability disclosure portal? what is the whole process behind that, and how do you have traceability with that? They want to see that whole plan, and then they want to also see if the vulnerability identified affects a patient, how am I going to deploy securely a patch or update my device, which is on the right side there. We need a real plan where we monitor, we have a way somebody can disclose of a vulnerability, and we have a patch cadence. We have this all defined. The time to think about how to do the patching and updating is in the pre-market plan, not when an incident happens. The fifth habit on the left side there to drop is treating the SBOM as a one-time attachment. The SBOM is a continuous thing you have to monitor, the software bill of materials. One ingredient of the SBOM or one third-party component today that had a low-risk vulnerability may have a high-risk vulnerability tomorrow. So it's important you monitor the SBOM continuously and have a process behind it, which is part of your post-market management plan, to respond to any changes in the risk profile of the ingredients of the SBOM and make the proper adjustments. People like to say that cybersecurity is a necessary evil. I don't believe it is. I think it's a competitive advantage, especially in medtech, when many of your competitors have probably not thought about cybersecurity, and the time to market is going to get delayed if they haven't thought about it. So it will give you a competitive advantage to start thinking about cybersecurity early on, from the design and all the way thinking about it through the entire product lifecycle to disposal. And it will allow you to get to market faster, not just through the FDA, but also the healthcare delivery organizations are starting to require very stringent cybersecurity controls. So the FDA is one gate, but the HDO or the organization you're selling your device to wants to see cybersecurity built into that device as well, and they want to see how are you going to patch that device. Hospitals are notoriously compromised, or hospitals are notoriously famous for being compromised and ransomware and other things, so they're trying to do their best to make sure the devices they put on their environment are secure, and this includes the medtech products. So 524B has made cybersecurity mandatory. At Blue Goat Cyber, we try to make it easy for you. We have a process and an offering where we can do all the documentation, all of those 18 deliverables, all the testing. I group testing into 3 buckets. We have the penetration testing, the software bill of materials, and the static application security testing. We can do all that and help you formulate the post-market management strategy as well. And if you're early on in the design phase, we can help you make the right design decisions in terms of cybersecurity. So feel free to book a 15-minute call with us at bluegoatcyber.com.